Good afternoon, everyone. Welcome to our second community briefing. I wanted to start today with a little bit of logistics for the day. We've gone ahead and muted everyone on the line just so you don't have to worry about any background noise. If you have any questions throughout the program, please go ahead and submit those via the Q&A button on your screen. We're reserving time at the end and we'll get through as many as we can. And then if you run into any technical issues or questions, you can also submit those via the Q&A bar. So for those of you who joined us last month, our first community briefing was on our 211 Help Center, the data on the calls that we'd been receiving and our response to those needs. Today, we're going to continue in that vein of data and response and are looking at the effect that COVID-19 has had on our under-resourced communities. Mile High United Way, as you'll hear in the rest of the presentation, focuses much of our efforts on those communities who need us most. We see every day families struggling to keep food on the table, the lights on, and a roof over our heads. Knowing that the opportunities provided by our volunteers and our donors who have stepped up to support those families makes me immensely proud. And so I wanted to start today by just saying thank you. Thank you for caring about our community. Thank you for stepping up when it is needed most. We are incredibly grateful and are working hard to ensure that we can support everyone who needs us. So since we have a little more than 100 people on the call today, I thought I would start by introducing myself and those that will be speaking and then give a little history about United Way. My name is Chelsea Carver and I am the Chief Development Officer here at Mile High United Way. Also joining me today are Tim Main and Frankie Angulo Olais. So I started the presentation today with these two photos, and what you'll be able to see is the photo on the left is Denver, in 1887, and the photo on the right is Mile High United Way's offices in 2019. So for those of you that don't know, Mile High United Way was founded here in Denver in 1887. We were founded in the middle of a rampant tuberculosis outbreak, and it was a bunch of community leaders that banded together to say, we can do more together, we can take care of our own better together. And so fast forward to 2019, and yet again, we are in the face of another pandemic, and Mile High United Way is doing exactly what it did in 1887. So what I wanted to then talk about is what Mile High United Way does as the role of this community convener. So since we were founded in 1887, we look at this very unique place within our community, in the middle of nonprofits, in the middle of corporations, in the middle of our government and our individual philanthropists. And we work to ensure that we can support our community in the best way possible. As part of that coordinated community response, I wanted to give a few highlights about how we are supporting the state in our partnership. So we are serving as the fiscal sponsor for the Colorado COVID Relief Fund, which is now at just over 18 million, and more than 100 grants have been sent out to nonprofits in our community. We're also proud to serve the City and County of Denver in their work to support small businesses and be the one-stop shop for virtual volunteering throughout Denver. The Denver Economic Development and Opportunity, that's DEDO, has established a $2 million emergency relief program that provides cash grants up to $7,500 to qualifying small businesses. Mile High United Way will help administer this program and provide consulting and technical expertise to those businesses as well. In addition to that, Mile High United Way has taken over 36,000 calls on our 211 Help Center from members of our community who are seeking resources and support, who are worried about how to keep a roof over their heads and food on the table. And then the other thing that we're really proud to support as a part of this coordinated community response is our nonprofit community. Late last month, we made an additional $1 million grant $1 million in additional emergency grants to 50 nonprofit partners in our community. These grants ranged from a tiny food pantry that was the only one serving that community to child care centers that can remain open so their parents can go back to work. So from that coordinated community response with city and the state and our nonprofit and our business leaders, down to our direct programming within our neighborhoods, all the work that we do has one goal, which is to build strong communities and families, and we do this through our United Neighborhood strategy. United Neighborhoods uses the data that you're about to see, which is collected by our incredible evaluation team and helps us focus all of our resources where they're needed most and where they can be most effective. And so with that, I will hand it over to Tim Main, who is our manager of evaluation, to walk through what exactly our front range looks like right now.
Great. Thank you, Chelsea. So hi, I'm Tim Main, Manager of Evaluation and Learning. I'm happy to be here today. And I want to just set the stage, as Chelsea said, for what does poverty and need look like across our Denver metro area. And so what you're seeing now is a map of our 7-county metro area where just over 3 million people live. About 1.2 million, or just under half of these people, are living below self-sufficiency level, which I'll describe in just a moment. And about 11%, or 320,000 of these people, are living below the federal poverty line. And so what this next slide is then describing is how, or what does self-sufficiency look like in Denver County? So to make ends meet, a family of 4 living in Denver County needs to make about $75,000 per year. However, the median annual income for a household in Denver sits at about $60,000. So there's already a $15,000 gap between what a family needs to make ends meet. In one of our poorest neighborhoods in Denver, Globeville, the median income there is just under $40,000. And those 320,000 people living under the federal poverty level for a family of 4 is under $26,000. And so this family living in poverty needs to make $50,000 more a year just to be able to make ends meet in terms of having food on their table, having access to internet, telephone, cars, and transportation. And so at United Way, we asked, where is poverty concentrated across Metro Denver? Because we know that people who live in areas of concentrated poverty lack access to the opportunities they need to thrive. And many of these kids, as they're growing up, will face further challenges in the future, such as poor education, higher rates of unemployment, as well as serious health conditions. And so what this map is showing is all of the census tracts or neighborhoods across the 7-county metro area that have higher than average rates of poverty. So that means there's more than 11% of the people in these neighborhoods who live in below the federal poverty level. And that starts up north in Longmont, comes down through eastern Boulder County into Adams County, and then the poverty is mostly concentrated along our major highways. And in these highlighted neighborhoods, just under 221,000 people are living in poverty. And that's enough people to fill every major stadium in the metro area, to give you a sense of how many people that is. And finally, we know that when you compare where is poverty the highest to where is COVID-19 been disproportionately impacting people, this is a map from Denver Public Health that shows neighborhoods within Denver County. And you can see that this map overlaps very closely with where poverty is highest, as you saw in the last map. So places like Montbello up in the northeast section of this, Northeast Park Hill, areas around Westwood in West Denver, all have much higher incident rates of COVID-19 than the areas of higher income. And so with that kind of setting the stage for what does poverty look like across the metro area and how is COVID impacting this? I want to turn it over to Frankie to talk more specifically about how these communities have been impacted by this pandemic.
Thank you, Tim. Good afternoon, everyone, and welcome to our community briefing. So I just wanted to start with these headlines. I'm sure you guys can all see them. They're probably familiar. You've seen them before. But when we think about, the United Neighborhood Strategy and all the data that Tim laid out, and you think about what you're reading here, all these headlines, it's important to understand the context for COVID-19 and how Mile High Netaway defines poverty and the inequalities it can produce. So how poverty, shapes your chances of becoming infected with COVID-19 and the ripple effects it has on under-resourced neighborhoods is where I pick up the story. So again, we've seen these headlines, they're probably really familiar to us, but our work, that is Mile High Netaway's work in the communities, provide us with firsthand experience and how this pandemic is affecting our community. So we're going to get into a little bit about the COVID-19 effect and what we're seeing. So again, if you read over these statistics, and they're sobering statistics about how our fellow Coloradans are being affected by COVID-19. And for those essential workers on the front lines, the risks and the risk to their families are unimaginable. So you ask, after reading these statistics, well, what does this mean for under-resourced communities? Well, one of the things it means that they're living under extreme duress because they're struggling to put food on the table, pay their rent and their utilities, and access health care because they lack health insurance. So while these challenges are not necessarily new to these communities, being hit with extreme emotional, social, and economic challenges that undermines every aspect of your community's well-being and economic development, that eventually will get to you. And again, it's back to the headlines, right? We've heard many stories about small businesses going out, mom and pop shops, not being able to connect with friends at school. These things do eventually take its toll. Now, when you think about, well, who's doing this work at Mile High Netaway? Now we've got, under United Neighborhood Strategy, we've got a number of programs, and they work directly with those most impacted by the pandemic. So we work with elementary schools, we work with childcare providers, former foster care youth, and small businesses. And what you're seeing here, that's just a small number of our team. There's 6 staff members, but they're part of a much greater team. And I'd like to take this opportunity to share their stories. So these incredible staff members belong to the United for Schools and United for Families teams. They're the ones knocking on doors. They're the ones listening to the stories of our communities and providing financial support to those families most affected. These are the staff members who will not only help our families survive, but walk alongside them on a path to recovery and resilience. And we're going to get a little bit into their stories coming up here. But there are 2 issues that have profound impact, or have had profound impact, on those we serve. The 2 issues are these. The first one is limited or no access to technology, and limited or no access to financial supports. So there's a high probability that you've heard of the digital divide in this country. Again, sobering statistics as you take this in. In Colorado, COVID-19 exposed this divide with a vengeance, and here are some of those startling statistics. So a typical family who lacks access to the internet is Latino, is headed by a single parent who makes less than $50,000, has a child in elementary school, and is an essential worker. That's who's when you think about who it most impacts, what part of the community, that's kind of, a typical description of a family. So imagine your family or your child just not learning anymore. They can't, they've stopped learning how to read, how to write, how to learn math. Imagine having to homeschool your child from a cell phone. in a digital language you can't even understand. What this means is the inability to access technology is widening the academic achievement gap that may stay with these children for years to come. The other place that we're really, working with and working to support are the family supports. So what you see here is with the COVID pandemic in full swing, our United Neighbor Schools and United for Families teams, they continue to work alongside our families and our organizations. And here are some pictures of those families who we've supported. And of course you see Abril with the yellow mask. She's one of our staff members helping to deliver these laptops. So when you think about, well, who are these families? And so you see a woman she's wearing a dress with a white sweater. That's Blanca. So this kind of support was especially needed by Blanca. Blanca, and she's a caregiver for her great grandson. She's a primary caregiver, and she made sure he attended school every day. When schools moved to online learning, she didn't have the skills or technology resources to keep him connected to school. So you could imagine what happened with his time. When Mile High United Way provided her with a laptop and training, her great-grandson was able to attend his virtual classroom. And this really supported his need for, being connected to his, to his buddies, to his friends, and then most importantly to his teacher. And so I think the other place that when we think about, what other kind of supports that we provide are those supports. And so now we're talking about direct service supports. So again, here's a mom, and you can see some of the things that, we've helped to support. So Mile High United Way also provides direct client assistance with grocery stores, gift cards, rent and utility payment assistance, and emergency gift cards for health-related services. So, and this type of assistance was especially welcomed by Belém, who's a mom who recently lost one of her 2 jobs because of COVID-19. And the job she was able to keep, well, they reduced her hours. But we were able to assist her with a food gift card and laptop, enabling her to catch up on rent, payments, and providing her child access to remote learning opportunities. One really important aspect of this work is when our teams, our staff, are sympathetic listeners to these families, to what they're going through, who share their frustrations and anxieties about the uncertainty of what's to come. Because of the trust we've built over time, our families are candid about what they're going through and often shedding tears. One of the most important roles we play is being witness to the strength, ingenuity, and determination these families have, and they demonstrate during this crisis, and always grateful to people like yourselves who care enough to give. In closing, our families are resilient, but they're being tested. And this here, what you're seeing with this mother and her 3 children, this story is specifically heart-wrenching. So Margarita, who's a staff member, and you saw her picture earlier. So Margarita recently, she checks in with her families often. She calls them every day, and she learned that one of her families was struggling. So Margarita paid a visit to this family. So outside, you can imagine, outside the home, you've got Margarita and a mother standing 6 feet apart and wearing masks. And as a display of concern for one another, this nevertheless gave them an opportunity for Margarita and Maria to acknowledge how vulnerable they were during this pandemic. However, Maria's anxiety included not being able to feed her children. And so although Margarita and Maria were standing there talking, eventually Maria, tears kind of gave way. And her tears, kind of filled Maria's eyes. And as she walked over and opened a bare refrigerator, Margarita kind of just stood back. And this is something that, Maria really wanted to show Margarita. But Margarita was there to help support Maria, and she handed Maria a gift card. And as Maria wiped her eyes, she said, "This is going to save me and my children's lives." So these are just a few stories illustrating, what we do and why we do it. Mile High United Way not only addresses the crisis at hand, but also understands that the real work is ahead of us. We are not just thinking about tomorrow, but about 2 months from now and 2 years from now. One example of this is addressing the digital divide now, because of this long-term impacts on the education of our youngest community members. So again, thank you for the opportunity that you gave me to share this with you, and I will now hand this back to Chelsea.
Thank you, Frankie. We have a couple of questions that have come in while you all are speaking. So again, for those of you that may have a question, please feel free to go ahead and pop that in the chat, and we'll get through as many as we can. Frankie, I have the first question for you. It says, how did you find these families in need of the support? Was it just going door to door, or did you work with the schools to find these families?
Yeah, so our teams do two things. Our United for Schools family, they work with the schools themselves. So for example, the principals or the social workers or the parent liaisons, and to identify those families of most need. But we also have parent leaders who reach out, who are also kind of community leaders. And so they also help, kind of inform us and let us know which families are struggling and what they need for support. And our United for Families team, they work with childcare providers, for example. And so through the childcare providers and other, nonprofit organizations that, like for example, Play and Learns, who've got families involved, well, they also let us know. And our United for Families team also speak on a regular basis with those families. So we're always very much connected to not only families, but the nonprofits in a community, and all that information comes in. And, we follow up on phone calls, and we make sure we get the resources where they need to go.
Thank you, Frankie. We have another one in here about laptops. So it says 42 laptops sounds fantastic. Do you have a sense for how many more might be needed? And I know that was sort of our first purchase, but Frankie, do you want to speak to a little bit more about how many more we'll need and the waves in which we'll purchase those computers?
Yeah, and I think you bring up a really good point, Chelsea. So they're going to definitely come in waves. We still have a number of families without access to technology like laptops. So we're probably looking at 100 or 250, at least for now. So one of the things we're trying to address now is that summer slide. So we've got to get these families connected, internet services and those laptops. And we're hoping to reach every family and every school and the families who are in, childcare or preschools, to make sure they're also connected. Because what we know is that tentatively now, at least in the fall, most school districts will be doing a kind of a hybrid of just both in-person schooling, education, and remote learning. So for the next couple months, it's really going to, it's going to ramp up very, very quickly. We've got to, again, reach those parents and make sure everyone's connected, but also get the parents trained and ready to do some remote learning. So Chelsea, I think it will come in waves, but I would say right now in the next month or month and a half, it's about 100, 150. And I can imagine that's going to pick up at least another 100, if not more, probably 200 by the time we get to just before, the beginning of school.
Thank you, Frankie. I have another one, Tim, for you. that asks if there was anything when you were doing the heat mapping of our community that surprised you, and anything else that you would want to address to the group there.
Yeah, that's a great question. I think not necessarily surprised, but something that really stood out is how prominent some of these disparities are, even just kind of across the street from each other. So if you think back to that COVID-19 graph I showed, you can see really high rates of cases of COVID-19 in both Northeast Park Hill and Montbello, both neighborhoods of low income. And then when you look at the Stapleton neighborhood that's smack dab in the middle of both of those two neighborhoods, they have very low rates of infection. And so I think that just really paints the picture about how these low-income communities are disproportionately affected by everything that's going on, not even just their exposure to COVID-19, but also all the things that Frankie was talking about, the internet access. Most of them are likely losing wages, losing work. Access to education is really difficult. So, you know, just 4 lanes of traffic across Quebec Street, there's families not experiencing that. And I think that's really what stood out the most to me.
Thank you, Tim. Okay, so it looks like we have about 1 or 2 minutes left. There's an additional question here, Frankie or Tim. How many neighborhoods are you focused on at this point?
Tim, do you want to take the question?
Yeah. So right now we're in Globeville and Elyria, Swansea in Denver. So that's the neighborhoods just beneath I-70 and I-25 where all the construction is happening. And we're also in Southern Adams County in 4 schools in the Thornton area around the neighborhoods near I-25 and 84th Street. We're also planning to expand United for Families into a school in Aurora that we're still working to identify.
Thank you. Frankie, anything else you'd want to add there? No, I think that about covers it. I mean, again, I mean, we have multiple programs and, you know, we really do listen to the communities about what they need, and based on what they need, and then we respond. We kind of mobilize our resources and our programs to meet that need. So again, you know, children from 0 to 12 and their parents and small businesses, including, you know, our foster care program and our 211. I mean, they're all incredibly important to our work.
Perfect. Final question, and then we will wrap up. A question for you, Tim or Frankie. Someone is wondering about from last month's 211 data, if those who are calling is requesting help is also correlated with the communities that we're working in.
Tim?
Yep, that's a great question. So I don't have that data right in front of me, but anecdotally, I would say yes, we are seeing those requests coming from these low-income communities. And we actually have a really exciting new platform that should be launching within the next couple weeks called 211 Counts, where folks will be able to go and see all of that 211 data online and be able to see it by zip code, by neighborhood, by congressional district. So we're looking forward to getting that out and getting that 211 data about the needs of our community facing the public more.
Fabulous. Okay. Well, with that, if you have any other questions, please feel free to keep submitting them. If we have your email, or if you want to make sure that we can get back in touch with you with some of those answers, just make sure to include that and we'll get back with you. But I wanted to go ahead and leave you with a few things before we close today and make sure that we're really respectful of everyone's lunch hour here. The first is we have lots of opportunities for you to volunteer virtually and safely as an individual, as a family, or as a group. That link is right there on your screen. You can also reach it via our homepage. My kids and I actually did this together this weekend, and it was really a nice way to have some meaningful family time. The second one, obviously, we are always grateful for those who are investing in Mile High United Way and these recovery efforts as they as they continue. And the final one, I was just typing a response to you, Rachel, based on your question, but there was a question about how we can connect others beyond sort of those essential emergency needs like food assistance or rental assistance, like mental health and disability. So that calling 211 or visiting 211colorado.org is an amazing resource for those who are looking to be connected to a multitude of human services resources throughout the Front Range and beyond. And so I wanted to end, all of this information, by the way, will be sent to you in a follow-up email, so don't worry if you didn't get a chance to write all of that down. I wanted to end today on this slide and reiterate my note of gratitude that I started with at the beginning. There is a lot of data that we can show you. There's a lot of headlines that we can read to you, but at the end of the day, it's this family that what you do supports. Everything that we strive for and everything that we're proud to say that we're doing in this community comes down to a mom hugging her 3 kids and being able to provide food for them going forward. So with that, thank you very much. We're grateful for your support and we look forward to seeing you next time. Have a wonderful day.